Welcome. In this video, we're diving into an important and often overlooked question: how does gout impact life expectancy? If you or someone you love lives with gout, understanding the long-term implications can help with smarter healthcare decisions. First, what is gout? It's the most common type of inflammatory arthritis, caused by elevated uric acid levels that lead to painful joint flare-ups. But those crystals don't just affect joints. They can also signal underlying health risks well beyond arthritis itself. Studies consistently show that people with gout have a higher risk of premature death compared to those without. For instance, a study revealing a 25% increased risk of premature mortality in gout patients versus healthy individuals. Another large-scale analysis indicates a 13 to 32% higher risk of all-cause death within 10 years among gout patients, women being particularly affected with cardiovascular death contributing significantly. So what drives these statistics? It isn't the pain from gout alone. Rather, it's the associated health conditions, like hypertension, kidney disease, diabetes, metabolic syndrome, and especially cardiovascular disease, that often co-occur. One long-term study of nearly 1,200 Spanish gout patients found that those failing to keep uric acid under the guideline target of 6 mg DL had over twice the risk of mortality, most from cardiovascular or other systemic conditions. Survival models show gout patients are not only coping with arthritis, they often face higher rates of hypertension, obesity, coronary artery disease, and chronic kidney disease. A 7-year survival study found just 85% survived, and 2/3 of deaths were linked to cardiovascular issues. Here's the good news: active management makes a difference. Treat-to-target strategies aimed at lowering uric acid to under 6 mg DL, along with treating comorbid conditions and lifestyle modifications, are associated with better outcomes and improved survival. Guidelines from the European League Against Rheumatism reinforce the importance of maintaining controlled uric acid levels to potentially improve life expectancy. In summary, 1. Gout is more than painful flare-ups. It's a chronic condition linked to an increased risk of earlier death, primarily due to cardiovascular and renal complications. 2. Elevated uric acid levels, TOFI, and unmanaged comorbidities are major contributors. 3. But with proper medical care, uric acid control, and healthy lifestyle choices, patients can significantly reduce these risks and support better overall long-term health. If you're living with gout, talk with your healthcare provider about monitoring uric acid, managing related conditions, and following a personalized treatment plan. Understanding your risks and taking control can help you live better and longer.